The Black Plague, SARS virus, COVID-19 virus, and HMPV virus. From ancient times to the modern era, China has been the epicenter of many pandemics that shook humanity. From the Black Plague to the new coronavirus, these outbreaks mark major turning points in human history. But how did they emerge? What conditions made China a hotspot for some of the deadliest pandemics? And is there really a conspiracy theory? Hello, friends, and welcome to our channel. Support us with a like and subscription so we can always bring you the best. The Black Plague, also known as the Black Death, emerged in the 14th century and had a devastating impact on China before spreading to Europe. The plague is believed to have originated in the Mongolian region and traveled through trade caravans to major Chinese cities. This pandemic caused local economic systems to collapse and led to significant social changes. Estimates indicate that millions of people lost their lives in China due to this pandemic, making it one of the deadliest outbreaks in human history. In the late 19th century, the third plague pandemic emerged in Yunnan province, southern China. This plague quickly spread to major port cities like Hong Kong and then to the world. Maritime transport contributed to the plague's spread to India, Africa, and even North America. This pandemic lasted for decades and caused over 12 million deaths worldwide. In 2002, the SARS virus emerged in Guangdong province, China. This virus jumped from animals to humans and rapidly spread to other countries. About 8,000 people were infected, with a mortality rate of 10%. Although its spread was short-lived, SARS served as an early warning of the danger posed by zoonotic viruses. But the largest modern pandemic was COVID-19. In late 2019, it appeared in Wuhan, central China. The virus caused global lockdowns and affected all aspects of life. With over 700 million confirmed infections and millions of deaths, COVID-19 is considered one of the deadliest pandemics of the modern era. The human metapneumovirus, HMPV, is a respiratory virus causing a surge in infections. This virus can lead to anything from mild cold-like symptoms to severe illnesses like bronchitis and pneumonia. The alarming part? Its rapid spread and its impact on vulnerable groups like children, the elderly, and those with weakened immune systems. What makes China a starting point for some of these pandemics? The belief that diseases always originate in China isn't entirely accurate, but it is based on certain factors that make China a frequent hotspot for emerging diseases. China is a vast country with extensive natural environments such as forests and agricultural areas where humans live in close proximity to wild and domesticated animals. This closeness increases the likelihood of diseases jumping from animals to humans, known as zoonotic diseases. Additionally, high population density in cities makes the spread of diseases rapid once they appear. And in some Chinese regions, interaction with wild animals for food or traditional medicine is part of the culture. This increases the chances of viruses transmitting from animals to humans. Wet markets in China, where live animals are sold alongside meat, are ideal environments for viruses to transfer between different species and then to humans. China is a global economic hub and a major transit point. Any disease that emerges there can easily spread to other countries due to international travel and trade. China has advanced disease surveillance systems. New diseases may be detected there not only because they are more prevalent, but also because the healthcare systems can identify them faster. The emergence of diseases like SARS and COVID-19 has created the perception that diseases often originate in China. However, zoonotic diseases can appear anywhere there is close interaction between humans and animals. We can conclude that China is not the sole source of diseases, but it is an ideal environment for certain types of infections due to environmental, cultural, and economic factors. Global awareness and efforts to improve health conditions can help reduce the likelihood of disease emergence anywhere. However, what is considered a conspiracy may simply be the result of natural competition between global powers, rather than necessarily being a coordinated secret plan. It is always better to analyze events rationally and rely on credible sources.